Eosinophilic Granulomatosis with Polyangiitis, EGPA. This is a rare, chronic inflammatory condition that affects multiple parts of the body. Previously, this condition was known as Churg-Strauss syndrome. The condition was renamed in order to standardize how we refer to different types of vasculitis. It's distinct from other forms of vasculitis, in particular granulomatosis polyangiitis (GPA), which was formerly called Wegener's, because it specifically involves overactive eosinophils. These are a very specific type of immune cell. They're normally involved in helping fight off parasitic infections and are often commonly seen as part of the process in allergic reactions. In EGPA, these cells in particular become overactive, leading to inflammation and damage in various organs throughout the body. It can involve the skin, lungs, sinuses, nerves, muscles, heart, kidneys, and even the central nervous system. EGPA is a rare condition. It only affects around 1 to 2 per million in the UK per year, with perhaps 10 to 15 per million living with the condition. The incidence varies according to different populations, but the rarity of this disease makes it difficult to get exact global figures. It presents in adults and it can affect people of any gender. It may be more common in those who have a history of asthma or allergies. Potentially, though, this is simply a part of how the disease itself presents. We haven't worked out the exact cause. There's likely to be a genetic factor which is precipitated or brought on by a specific environmental trigger. Once this has been activated, the immune system attacks the body's own tissues. This attack causes inflammation of the blood vessels, particularly medium and small-sized blood vessels, and this can cause damage to the organs. As we've heard, the overproduction of eosinophils is particularly characteristic. These accumulate in tissues and form granulomas. These are clusters of immune cells that themselves can cause further damage to the affected area. In very severe cases, this overactive eosinophil production can directly become toxic to organs, such as the heart. EGPA is classified as an ANCA vasculitis. This means that there's a particular kind of antibody called the anti-neutrophil cytoplasmic antibody, or ANCA. The pattern of antibodies in EGPA is different to that of GPA. This can be seen on a microscope as having a perinuclear ANCA pattern, or P-ANCA, which is distinct from GPA, which is given a C-ANCA pattern. In addition to the pattern, a specific subtype called myeloperoxidase, or MPO, is often found. However, P-ANCA and MPO antibodies are not only found in EGPA, but some other types of vasculitis as well. Diagnosing EGPA can be challenging because the symptoms overlap with other conditions and because it's rare. The first step is to review the story or patient's medical history. A physical examination follows, and blood work is usually the next step, in particular searching for a high eosinophil count. Other blood tests, such as checking for these antibodies, but also to measure a particular antibody called IgE, which can also be elevated in people with EGPA. Imaging techniques, such as a CT scan, for example, of the lungs, or an MRI, can help visualize organ damage. A biopsy can be particularly helpful to confirm the diagnosis, which might involve taking a small sample of affected tissue, such as the kidneys. Treatment of EGPA focuses on controlling inflammation and managing symptoms to protect the organs from further damage. Medications like steroids are commonly used early on. Immunosuppressive drugs like cyclophosphamide might be used for the more severe cases. For long-term management, azathioprine and mycophenolate are used. An alternative to cyclophosphamide could be biologic drugs like mepolizumab. Sometimes rituximab is also used. Because EGPA can affect multiple organs, patients often require the input from multiple specialists. This team could include a rheumatologist at the centre. Respiratory specialists often pick this condition up as it presents with difficult-to-treat asthma commonly, nephrologists, who deal with the kidneys, and other specialists if these organs are involved. Regular monitoring is essential, not only to detect flare-ups and adjust the treatment plan, but to monitor for any potential consequent long-term damage, and add in secondary drugs to help mitigate against the risks of these. Lifestyle changes do play a role, in particular management of asthma triggers, and sometimes ongoing physical therapy can help to improve mobility. Because of the rarity of this condition, treatment plan for EGPA is individualized and tailored to your specific severity of disease. While this condition is rare and living with EGPA can be challenging, thankfully we are seeing with early intervention, personalized care, and modern therapeutic interventions, patients can live a good quality of life, and long-term consequences can often be prevented.